My name is Sarah Nash. I'm 18 years old, and I'm from Eastern North Carolina. I love animals, and I'm going to Mount Olive for animal science. Ridden horses, shown goats, the whole livestock thing. I own rabbits. So that's pretty much my entire free time, besides just, regular house chores. My uncles and my aunts and everybody on my dad's side of the family has back issues.
Sarah is unusually young to suffer from lower back pain. This led many around her to doubt the severity of her issues.
Whenever I would get off work, I just had to go lay down. I couldn't really move, but if it was a weekend and I didn't really do much of that stuff, and it's hard being like that, being so young, because everybody else they think I'm just getting out of work. My back hurts, I can't do that. Like, animals is something that I'm really passionate about, so like I'm not trying to get out of it. It's just I'm hurting and I don't want to, so like I'd say as little about it as I could, but at the same time, it was really bothering me at home, and I couldn't do anything after work. Like, I couldn't vacuum my house, and I couldn't mop my floor or do my laundry. So it was kind of that was it for the day. Where we live, the doctors and everything, I'm not sure if they really looked at my MRI, because it took me a year and a half. I've been dealing with it, and it's gotten worse every day. I've gotten an MRI back at home. I've done the physical therapy, the injections, I've gone to rheumatology. I just felt like they were just sending me different places, juggling me so somebody else could deal with me. And it would hurt after physical therapy and on the ride home and everything.
After trying conservative treatments with no relief and getting the runaround from doctors in her hometown, Sarah started to consider having surgery at the Bonati Spine Institute.
I first came here to the Bonati Institute when I think I was a freshman in high school, because my grandma had surgery and I really liked the area in Hudson. There's a few places that I really love going when I'm here, and we had a fun experience, because the first time we came, we we stayed in a hotel. I guess I just got familiar, and the people, like when we walked in, they already know your name and everything.
Upon arriving at the Bonati Spine Institute, Sarah was provided a physical exam and sent for updated MRIs at the on-campus imaging center. A short while later, she met with the surgeon to review her images and discuss a customized surgical plan to eliminate her lower back pain.
It's really convenient, because you don't have to. If they decide they want you to get an MRI, you just walk over there and get an MRI. And the people are really nice everywhere, and you see some of the same faces that are in the, doing the MRIs and in the operation rooms and out in the waiting area. Like, it's kind of the same people, so you already pretty much know everybody. You're not going into a completely different place, and they already know you. Because one thing that aggravated me before was having to tell the same symptoms and the same everything to just a bunch of different people and never getting anything done. Like, after a year and a half at home trying to figure out what was wrong with me, I came here, and the first day at Bonati, it took like a few hours to get a diagnosis that I didn't have at home.
The exclusive Bonati spine procedures are performed on an outpatient basis, utilizing conscious IV sedation, where the patient remains awake and communicating with their surgeon to pinpoint their source of pain and eliminate it before they leave the operating table.
My first surgery was the left side L4, L5. I had a bulging disc in both levels that I had surgery on. I was awake during it.
No pain here?
No pain there.
No pain here?
No pain there.
Nothing here?
No.
All right.
It was kind of weird seeing the inside of your back on the screen. And I would ask him, the anesthesiologist, he was sitting in front of me, I would ask him, what is that? What are they doing now? And he would try to explain it to me. Like, since having the surgery, I still have some surgical pain. Like, I haven't felt the same pain in the front of my legs or going down my legs. It's all, the pain that I feel now is just, I can tell it's surgical and kind of is local to the incisions.
After a brief stay in the recovery room, patients are asked to walk, and then they're free to head home or to a nearby hotel to continue with walking therapy and have a follow-up appointment scheduled the next day.
It's kind of weird. I mean, I've never had any other types of surgery or surgery on my back, surgery in general, but I know people don't just get up and walk out during surgery usually, so it was kind of weird. Like, I felt like the process was kind of fast forwarded, and I could get in the car and ride home, and after I walked, which wasn't long, just walk on the other side of the room and then put my clothes on and head out. After surgery, they told me that walk 40 minutes a day, and if you can't do it all at once, do it in increments, because walking is the best physical therapy, is pretty much what she said word for word. But and then, ice, rest, walk. I didn't hear anything about back braces or anything like that. Just walking, doing what you think is best for you, knowing your limits, don't overdo it, don't pick up anything too much. Just let your body heal. I would definitely recommend Bonati to anybody I know that has back pain, because it was a really quick process. It took no time, and it was all in 4 days. I got a diagnosis and the surgeries, and I can already tell, like, I'm recovering pretty well. I can get up better already, and it's only been 4 days. It was just, I wasn't nervous at all. I was confident in everything, and I'd feel good recommending it to somebody I know.
Sarah is excited to return home to play with her dogs, work around the house, and start a new life as a college student, all pain-free.
When I get home, I'm looking forward to seeing my dogs, laying on the floor with them, hugging them. I like throwing toys for them, little tug-of-wars. I'm looking forward to being able to do just everyday tasks without thinking about my back pain. Like, I wasn't used to doing that before. It affected everything that I did. I haven't been able to really sit in a chair for a while. Sitting for long periods of time would aggravate me, and I'm about to go to college, so I kind of need to sit in a chair in a classroom. So I guess I'm looking forward to being able to sit in a classroom without having to stand up or walk around, just sit there like a normal person.